I wasn't aware of these kinds of treatments even existed until I was introduced to them by Dr. Ben. The fact that I could go through a treatment without having to have a surgery, without having to take more shots, more drugs. Operations and surgeries are maybe not always the answer. This happened to be the tool that worked absolutely for me. My name is Ken, and I'm from Manchester. I came to InMotion Pain Solutions for my severe back pain. It was difficult to sleep, honestly. I could not find a good position to sleep in on my back either side. I would wake up numerous times during the night. And when I get out of bed in the morning, it was very difficult to get up and walk down a hallway that's like 40 feet to the kitchen. And it was extremely difficult. And I would have to stop at time to sit down before I could even get to make my cup of coffee. Couldn't do much of anything, actually. So it was really beginning to limit anything that I wanted to try and do. It was very painful. It gets to you mentally. Physically, there's the pain, obviously, but it's the mental part of not being able to do what you have been doing or would like to do, and your quality of life starts to shrink. I met with several orthopedic surgeons and neurosurgeons, and they suggested that putting the rods and cages in my back and doing a multi-level fusion down in the lower back. They said it may help with certain things, but there was no guarantee that the pain would go away, and that was really concerning. We happened to be watching television one evening, and on came Dr. Ben. We looked at it and thought, got nothing to lose at this point in life. I learned a lot from him. He pulled up my MRI, showed me what the thing was, and determined that a lot of it had to do with scar tissue that was developed from way back in 1974 from my major back surgery then. That was very impressive because I had not had it explained in that detail through many doctor's visits. The therapy offered here by Dr. Ben at InMotion Pain Solution was much different than anything that I had ever been talked about regarding alleviation of pain. It was brand new to me. Initially, when I came in, I wanted to know, what he thought the chances of getting better were, and we set it up at like 50 to 60%, whatever, at that point. And I would take that at that point because it was bad enough. If I could be half better, I would feel great. As we moved along, I'm sitting here today with zero pain. Today I'm able to move around pain-free, get from my bedroom to the coffee pot in an instant. Don't have to sit down and take a break. And I have zero pain, zero. And it's just amazing to me and so thankful. I would highly recommend, encourage them to take the step, take a look, give it a shot, because it's unbelievable.